Hi everybody, thank you for watching my video if you chose to. I hope you like this very strange PowerPoint background. I was told that it was creepy, so I didn't put it on everything, but I thought that the ear was nice, so I'm going to use that, and hopefully throughout this presentation I can give you some clues and hints at what's going on with this patient. So they were first seen in 2014, but our charting system only goes back to 2018. So the only note that I could access was from 2019. This was an audiogram done on a 73-year-old female. The audiogram from 2014 showed us that she did have bilateral sensory neural hearing loss, but at this point she didn't have any hearing aids. She does have a family history of hearing loss, both of her parents and then grandparents on one side. I didn't take the history, so again, I'm not actually quite sure which one, but that was in there. At the time, she denied any drainage, oral fullness, pain, tinnitus, dizziness, imbalance, vertigo. So other than hearing loss, she was doing okay as far as the ears go. She's also never had ear surgery, no history of recurrent otitis media, at least in her adult life. We're not quite sure about her childhood, and then she denied any excessive noise exposure. So this was the audiogram from that appointment, and she decided to go ahead and be fit with hearing aids. And the previous audiologist that was at my clinic fit her in Oticon Opn S2 RICS with closed domes with a single bass vent and 60 gain receivers, which is definitely appropriate for what was going on here. So that's what kind of how she started out with hearing aids. She's come back for regular follow-ups throughout the past 2 to 3 years. Usually it's just a clean and check, replacing domes and wax filters, everything like that. When we do a new audio, she would be, the programming would be updated to that, and overall the notes seem to state that she's been happy with the devices. And then she came in a couple weeks ago, and this is when I saw her for the first time. She is now 76, and she came in for a hearing aid check. The big thing that she needed help with was changing her wax filters, because sometimes those Oticon wax filters can be tricky. So I taught her about that, but as we were talking, I noticed that she wasn't hearing me well, and she was with her husband, and they both said that she's had a lot of difficulty hearing over the past week, and she said that she had some slight oral fullness. She didn't necessarily think that it was a big concern or wasn't really out of the ordinary, but it also hasn't been going on all the time. She denied any drainage, pain, tinnitus, or dizziness, vertigo, vestibular symptoms. So the only change was pretty much her hearing. So I went ahead and I cleaned her hearing aids and I listened to them, and they sounded great. So it kind of ruled out that her hearing aids needed a cleaning or there was something going on with the hearing aid that was giving her difficulty hearing. So of course the next step is to figure out if it's something with the ear. And when I looked in her ears, this is roughly what I saw. We don't have a video otoscope, so this is kind of the closest comparison that I could find just on Google Images. So I would say what I saw mostly was stenosis, so it was very, very narrow. I actually couldn't even see the TM on the... Let me think about where she was sitting here. On the left side, I couldn't see it at all. On the right side, she had almost like a curtain of wax or debris, but the canal itself was very narrow and almost looked inflamed or swollen. I only used the otoscope specula, so I didn't touch it with anything. So as far as the texture or determining if it was actually swollen, I didn't have any tools to use. My preceptor ended up coming into the room just to say hello, because this was the first time I'd seen the patient, and I kind of told her what I saw, and she took a peek in there too, and she was kind of shocked with what she saw. So we decided to look back at this patient's audiograms, And you can see over the past 8 or so years, there hasn't really been a significant change in hearing, and there's never been a conductive component. So from our perspective, what was going on was new. We saw this patient on a Friday, and we are closed for the weekend, so our goal was obviously to try to help her figure it out as soon as possible in case she needed immediate care. We also looked at her TIMP history. This one on the left is from this past October. I did not do this, but my preceptor got a flat TIMP on the right ear and then got this kind of abnormal result on the left side. And from the notes, it looks like she tried this multiple times and it still had this configuration or this shape. So we're not quite sure. And then on the right side is the TIMP that I did when I saw her a couple weeks ago. And it was flat on both sides. So obviously there's something going on with her ears. A little bit of additional history to hopefully help kind of lead you to the right diagnosis. She reported that she was neglected as a child. I'm not exactly sure what that means, but as far as medical care, I think that's what she was referencing or referring to. She also reported a lot of ear problems as a child. Again, don't really know what that is, but we know that it wasn't otitis media because she denied history of that. She seems like a good reporter overall, so it's hard to tell if she wasn't sure about that history or if she maybe forgot the first time it was asked about. And then she also comes in for routine ear cleanings every 3 to 6 months, kind of depending on what's going on. So usually they're in conjunction with a hearing aid check, but sometimes I looked back and she comes in sooner. So it seems like that narrowing of the canal has been something that has been going on for a while, and she is not able, or her ears are not able to kind of take care of themselves, so she needs one of the physicians to do that for her. So my questions for everybody are, who did I refer this patient to? That one's probably pretty obvious. What do you think is the pathology? What's going on with her? And I guess when I ask this, it might be easier to say what's going on, but historically, how does it match up with what we're seeing? What treatment would have been recommended for her, and what are the expected outcomes with her, especially as a hearing aid user? So I am looking forward to seeing their responses, and hopefully I can follow up and answer some questions in the next video. Thanks for watching.